Lately, there's been much debate both online and offline about hydroxychloroquine. Is hydroxychloroquine the miracle drug promised as a cure for COVID-19? Can it help in early disease, severe disease, or even be used prophylactically? Well, let's examine the evidence coming up. The topic of hydroxychloroquine has resurfaced again as a group of doctors called America's Frontline doctors were touting the benefits of hydroxychloroquine as a cure for COVID-19. On July 23rd, Dr. Risch, a researcher from the Yale School of Public Health, authored a Newsweek editorial calling on doctors to immediately start treating patients with hydroxychloroquine. He also wrote a piece in the American Journal of Epidemiology citing 5 studies in the support of hydroxychloroquine, especially when used early in the disease. In this video, we will look at the evidence in hospitalized patients, trials with hydroxychloroquine and azithromycin, as well as towards the end of the video, see if triple therapy with zinc has any promise. I will also look at the trials cited by Dr. Risch towards the end of this video. Perhaps a word on hydroxychloroquine. It is a drug that has been used for 60 years and is currently being used to treat malaria and autoimmune diseases such as lupus and rheumatoid arthritis. I use it in my practice to treat rheumatoid arthritis as well as lupus as well. The main side effect is QT prolongation, and that's why we monitor the patients with EKGs, because there's a risk of fatal cardiac arrhythmias and the risk of toxicity to the retina of the eye. We always send our patients on hydroxychloroquine to the eye doctor yearly. In June 2020, the US FDA revoked its emergency use authorization for these agents in patients with severe COVID-19. On their website, they explained that based on ongoing analysis and emerging scientific data, the FDA has revoked the emergency use authorization to use hydroxychloroquine and chloroquine to treat COVID-19 in certain hospitalized patients. So why did they do that? Looking at the recovery trial in patients hospitalized with COVID-19, hydroxychloroquine was not associated with reductions in 28-day mortality, but it was associated with an increased length of hospital stay and increased risk of progression or progressing to invasive mechanical ventilation or death. The NIH halted a clinical trial called ORCID study, a multi-center, blinded, placebo-controlled, randomized clinical trial, which is the gold standard of study trials. The outcomes related to COVID-19 treated with hydroxychloroquine among inpatients with symptomatic disease was studied. The data from this study indicates that this drug provided no additional benefit compared to placebo control for the treatment of COVID-19 in hospitalized patients. And there was the Solidarity trial. These interim trial results showed that hydroxychloroquine and lopinavir and ritonavir produce little or no reduction in the mortality of hospitalized COVID-19 patients when compared to standard of care. But you might say that these patients were sicker, especially in the trial arms of the 3 aforementioned trials. There was a multi-centered, open-label, randomized controlled trial. Well, while looking at mild to moderate COVID-19 patients in the hospital setting, administration of hydroxychloroquine did not result in a significantly higher probability of negative conversion than standard of care alone in patients admitted to hospital with mainly persistent mild to moderate COVID-19. In fact, adverse events were higher in the hydroxychloroquine group than in the non-hydroxychloroquine group. Well, then the question is, what about the combination of this and an antibiotic such as azithromycin? In a multi-center randomized open-label 3-group controlled trial involving hospitalized patients with suspected or confirmed COVID-19. Patients were randomly assigned to receive standard care plus hydroxychloroquine at a dose of 400 milligrams twice daily, or standard care plus hydroxychloroquine at a dose of 400 milligrams twice daily, plus azithromycin at a dose of 500 milligrams once a day for 7 days. Among patients hospitalized with mild to moderate COVID-19, the use of hydroxychloroquine alone or with azithromycin did not improve clinical status at 15 days as compared with standard of care. This time, looking at an observational trial published in JAMA, looked at the following question. Among patients with coronavirus disease 2019, is there an association between use of hydroxychloroquine with or without azithromycin and in-hospital mortality? Among patients hospitalized in metropolitan New York with COVID-19, treatment with hydroxychloroquine, azithromycin, or both compared with neither treatment was not significantly associated with differences in in-hospital mortality. However, the interpretation of these findings may be limited by the observational design. But you might ask, what about this trial, the Henry Ford Health System trial? Did it not show some promising results? This was a multi-center, retrospective, observational study treatment with hydroxychloroquine alone and in combination with azithromycin was associated with reduction in COVID-19 associated mortality. This is good news, no? Looking closer at the data, there were potential confounders. For uncertain reasons, some patients with severe disease did not, per protocol, receive hydroxychloroquine. And there were more steroid administration in those who received hydroxychloroquine. If you're finding value in this video, don't forget to like, hit that notification bell, and subscribe. So what about using hydroxychloroquine in people who might have been exposed to the virus? In a randomized double-blind placebo-controlled trial after high-risk or moderate-risk exposure to COVID-19, hydroxychloroquine did not prevent illness compatible with COVID-19 or confirmed infection when used as post-exposure prophylaxis within 4 days after exposure. In May, in the Annals of Internal Medicine, a meta-analysis of 24 studies examining hydroxychloroquine concluded that there was insufficient and often conflicting evidence on the benefits and harms of using hydroxychloroquine or chloroquine to treat COVID-19. Now, how about triple therapy including zinc? Zinc is seen to have unspecific antiviral effects. Both hydroxychloroquine and chloroquine are zinc ionophores, meaning they can help transport zinc to the necessary area of the cell for effect. The thought is that this combination, given early in both the inpatient setting or outpatient setting, may help improve clinical outcomes. The question is asked in Kumar's article looking at the role of zinc supplementation, the potential role of zinc supplementation in prophylaxis and treatment of COVID-19. Some potential studies which might answer questions are hydroxychloroquine and zinc with either azithromycin or doxycycline for treatment of COVID-19 in outpatient setting. A randomized open-label trial with the study's completion date estimated on the 31st of December 2020. Now I can look back to Dr. Rich. None of the studies he looked at were randomized control studies. The first two studies he was quoting from were from Dr. Raylo. I hope I'm pronouncing it correctly. The initial study was criticized by some experts as having too small a sample size. The second did have a larger sample size, however, did not have a control group and nor was it randomized. The third was looking at a Google document presented by Dr. Zelenko, and Dr. Zelenko did look at close to over 400 patients treated in the outpatient setting without a control group. Finally, the last two studies quoted by Dr. Rich was one from Brazil, and that study was not randomized, and the last study in a long-term care facility did not have a control group and had a smaller sample size. Unfortunately, there were no randomized control studies, which are the gold standard of looking at studies. We might have more answers in the future if studies include zinc and hydroxychloroquine plus or minus azithromycin. However, now the science is pretty clear that hydroxychloroquine alone provides no mortality or clinical benefit. However, a word of caution. Several years ago, in the 90s, physicians were hesitant and reluctant to use beta blockers in the treatment of congestive heart failure. There was initial resistance to change prescribing habits. However, with more peer-reviewed studies substantiating the benefits of beta blockers, it has now become the standard of care. Likewise, until we get peer-reviewed randomized control studies looking at hydroxychloroquine and azithromycin or doxycycline as well as zinc, the question regarding the combination and clinical benefit early in the disease questions will continue to remain. Question of the day. If you have COVID-19, would you take hydroxychloroquine? Leave your answers in the section below. And if you're interested in any other videos, you can click right here, or click right here, or click right here, or click right here. Have a good day. Bye-bye. Good habit.